Hi, everyone. Welcome to another episode of Ascend TV. I'm your host, Dr. Leslie Cadet, and Ascend helps self-insured employers lower their workers' compensation costs, mostly through medical oversight. Today, I'm going to share a case with you, helping you understand the importance and the validity of work restriction reports. Sometimes they're called work notes. Sometimes they're called work status reports. So, we have a 33-year-old gentleman who works as a delivery driver, and approximately 3 months before the date of injury, he texted his supervisor to let her know that he was having pain in his neck and left shoulder. And he stated to her that he did not believe his neck and shoulder pain was due to anything that happened at work. He said, my neck and my shoulder, they've been bothering me since last week. I thought I may have hurt myself pulling on a wheel of cheese, but the more that I think about it, it probably was my pillow and the way that I slept last night. So it's either my bed or my pillow. About a week later, the supervisor checked in with the worker, and the worker confirmed that nothing that he was doing at work in the current moment was making his neck or shoulder pain worse. Again, the supervisor followed up approximately 2 weeks after that, where the worker continued to say that they were feeling better and nothing with their job was making their neck or shoulder pain worse. Moving into the future by about 2 months, the worker suddenly presented to his primary care doctor with neck and left shoulder pain. That primary care provider removed the worker from work for 3 days. While the worker was off of work, he reported the injury to his supervisor and said that he had moved 2 large wheels of cheese, and each wheel weighed about 100 pounds. And he believed that was what caused his neck and shoulder pain. He was wheeling these rolls of cheese off of the delivery truck when he started to feel pain to his neck and left shoulder. Once his off work note expired, he returned back to his primary care doctor and got another work note removing him from work for an additional 2 days. Well, at this point, because the injury had been reported, the insurance carrier reached out to the worker and informed him that he would need to follow up with an occupational medicine physician. Occupational medicine is a specific specialty of medicine that focuses on workplace injuries and understands the nuances and the healthcare needs of workers and employers. It is a tailored specialty specifically for employees and employers. And with that should come a higher level of knowledge in how to deal with workplace injuries than what you would get from a primary care provider. So he finally presented to an industrial doctor or an occupational medicine doctor, and he was given work restrictions. And the work restrictions were to not lift, push, pull more than 10 pounds and not to do any overhead lifting of more than 10 pounds. When he came for follow-up a week later, the work restrictions were continued, but the treating provider also provided a sling. Now, what's important to note is if someone is pushing or pulling a heavy object and they are diagnosed with a strain, putting them in a sling is not the appropriate treatment. For strains and sprains, you don't want to immobilize the joint. Movement, stretching, those are things that will allow the muscle to relax and for the strain or sprain to resolve more quickly. Keeping the joint immobilized is a sure recipe to have prolonged pain and inability to do the full job. So once he was given these work restrictions by the industrial doctor, he presented them to his supervisor, who then assigned him a light duty assignment, which was the appropriate thing to do. She asked him to do things like dust, to scrub sinks in the bathroom, to sweep and mop floors. So obviously, the worker having these work restrictions and wanting to be off for what had already been a week, is now being asked to go back to work. He's not interested in scrubbing any sinks. He's not interested in sweeping and mopping. He's not interested in dusting. And so he tells the supervisor, I can't do the things you've asked me to do because I'm wearing an arm sling. All right. So if you are a provider watching this episode, you can see how things that may appear innocent in the exam room, like the worker asking for a sling and you giving it to them when it's not medically indicated, that may have repercussions further down the line. And if the patient didn't ask for the sling and you as the provider offer it, you can see how this causes more problems than it does solutions. So we don't want to recommend treatments. We don't want to recommend equipment that is not necessary. So when the employee declined the modified duty assignment, the employer said, well, we will work with you. We will find something for you to do despite you wearing a sling. But around this time, Human Resources also asked for a copy of the work restriction form, which the worker provided to HR. But what HR noticed when they received a copy of the form from him, comparing it to the form that was given to the supervisor, additional work restrictions had been checked off, and it wasn't a typewritten checking off of additional restrictions. These looked like they were hand jammed, or someone went in with a pen on this computer generated form and checked off additional restrictions. And so this is the pearl for you as the self-insured employer. If you get a work restriction form that does not look right, or you have questions about it, or it looks suspicious, it is in your best interest to call the clinic that generated the note and ask for clarification. And so when the employer reached out to say, hey, we have two work restriction forms. One says no lifting, pushing, pulling more than 10 pounds, no overhead lifting. And this other form that we have says the same thing, but there are additional restrictions checked off, like no bending, no stooping. Which form is correct? And the industrial clinic confirmed that the first work restriction form was the correct form, and that anything else that had been checked off was not from the clinic. So you can guess who checked off additional restrictions on the work restriction sheet, right? That would be the injured worker. And so from that point, because the employer had policies in place about falsifying documentation, they were able to take the worker through the disciplinary process, which ended in termination. So the pearl for any self-insured employer watching this video is that if you have any type of work restriction form that does not look right, it is within your best interest to contact the clinic for clarification. And if you don't feel comfortable reaching out to the clinic for clarification, having a medical ally on your team who feels comfortable doing that type of work is a game changer and can save you a lot of headache and hassle down the road. I hope this episode was helpful. Until next time, peace.